Should GPs recommend sex and its physical and mental health benefits to patients? 0207 862 2222. That is the number. Why am I asking this? Well, that's what Dame Emma Thompson has suggested should happen. A few years ago, she starred in a film called Good Luck to You, Leo Grande, as a widow who hires a male escort to help with her loneliness. She now says that many of her friends have done exactly the same thing in real life, and she's now convinced that sex should be what she describes as part of our health plan and promoted by the NHS, because in her words, it's so good for you. But how would you feel if a doctor said to you at a routine health checkup, or because you've gone in with a toothache or a headache, how about sex? Are you having enough sex? Can we sort out some sex for you? Maybe just think, what the heck has it got to do with you? How impertinent and inappropriate. Or maybe you think, oh great, yeah, I haven't had enough sex. Come on, help me, doctor. I don't know, we'll have to ask. And we're taking your calls, 0207 862 2222. Let's ask Rebecca first. What do you think of this?
Oh my gosh, I'm becoming more and more of a prude as every sentence goes on. I cannot bear the thought of this. I really think how inappropriate. That is a line that's crossed. I mean, I'm one of those people that I'm afraid fast forward sex scenes on telly because I just think, oh, I feel embarrassed for the actors and, you know, not getting anything from it. What happens in my bedroom is what happens in my bedroom. I don't want to talk about it with a doctor if I've gone in for a twisted ankle or even, you know, something with the menopause. So therefore it's like, it is hormone related. I don't think it's an appropriate space to talk about that sort of thing. I'm not sure about how I feel about sex. I certainly don't want a stranger bringing it up. And in that 10-minute window, they've suddenly got to decide, actually, it's not a broken ankle, it's lack of sex. And clearly, I'm really surprised, Emma Thompson. I sort of think she must have been joking. Yeah. I can't possibly believe it, because otherwise I would have thought it was a man saying it. And I know that's probably really wrong, but I can totally hear a man saying, yes, we should prescribe sex to women. It's sort of like what the Victorians used to do with masturbation back in the day.
We have to say that she's married to the gorgeous Greg Wise, and he is a heartthrob and a matinee idol. So, you know, she's probably very, very keen on having marvellous boudoir time with him. I don't know. I'm going to ask William in just 1 minute, but hang fire for a second, because let's hear and let's talk to Dr. Ben Davies, who is both a GP and a clinical sexologist. I've never even heard the word sexologist. What does that mean, Dr. Davies?
Hi, Vanessa. Yes, it means I'm both a GP and I'm a sex and relationship therapist. So I do therapy, but I also do the medical parts of sexual pleasure. So if someone's got a difficulty with sex, whatever it might be, sometimes there's a medical problem, sometimes there's a psychological problem or a relational issue. And it's working all of that out, putting it all together.
Tell me about the benefits of sex. So Dame Emma Thompson has stated it's good for you. Is that true? Is sex good for you?
Yeah, so we know that sex does have lots of roles in terms of improving health around reducing stress, immunity, cardiovascular health, and relationship health and intimacy. We know that touch, oxytocin, reducing cortisol, all of these things sex can really help with. But it's not about just charging in with an inappropriate conversation, more about providing safe space for people to talk about sexual difficulties. And, you know, I trained as a clinical sexologist because I realized how little sexual pleasure was being talked in medical clinics and how often doctors as well as patients have sexual shame, which means it just doesn't feel safe to talk about. But people have complex relationships with sex, but it's about creating safe space to bring it to someone who's trained and can deal with it sensitively, as well as realizing that people have histories of sexual assault. And so to manage it in a kind of safe, containing way, not just charging in saying, have a glass of wine and have a bit more sex and you'll be fine.
So you wouldn't envisage saying to a patient who is there with a pain in the hip or a sore throat or, you know, a strained wrist, you know, well, what about your sex life? How's that? You know, are you not having enough sex? Are you having too much sex? Do you enjoy sex? Are you frigid? What's going on? You wouldn't imagine just broaching the subject yourself. You'd wait for the patient to mention it to you, would you?
So I do introduce it. So it is really important. So, for example, for health screenings or for people where I'm asking about cardiovascular disease, your sexual function, particularly erections, are a really important marker of both your hormonal and your cardiovascular health. So men with erection problems are more likely to have a heart attack in the next 5 years. So we need to take it really seriously, and it's not asked about. And so I see men who have asked for Viagra maybe 10 years ago, didn't have their cardiovascular health taken seriously, or that was a warning sign about their cardiovascular health. then having a major heart attack 10 or 15 years later. And that was preventable if a doctor had known to ask about morning erections and how erections were in sex. It's really important. And the same for women in terms of arousal or vaginal dryness. What else is going on? And so you have people who end up with just so many other medical interventions, but not actually someone who's not had a safe conversation about sex and realised what importance that might have for the rest of your health.
And let me ask you the final question really on this, Doctor, which is Dame Emma Thompson says in the film in which she starred, she is a widow who is obviously not having any sex, and she hires an escort. And because it's a film, the escort happens to be incredibly handsome, absolutely charming, intellectual, delightful, chivalrous, just in every way magnificent. And she says that she has friends who in real life are doing the same thing. Do you hear much about that going on?
Yeah, absolutely. So I suppose, having access to someone who you feel you're safe with, but people's sexual experience is the full range, right? From really unsafe and unpleasurable to really safe and pleasurable. And who that is takes a lot of intuition and working out who do you feel safe with. For someone, that might be someone who they've paid. But for others, it's really thinking about what is pleasurable, who is it pleasurable to be with, and really listening to your intuition about what your body is telling you and building on that, whoever that might be with.
Well, we really appreciate your joining us on the programme. Thank you very much indeed. The erection
Thank
part
you
of
for
the
having
conversation obviously just sailed right past me, but I had the feeling that William Sitwell was kind of crouching behind the cushions at that point. I didn't quite know what came over you. Certainly went rather pale. What do you think about it? I don't know.
I think in principle, I think it's a really good idea, because I think that too often in that 10-minute window that you get with a doctor, there is this sort of knee-jerk reaction to prescribe drugs and to send a prescription to the pharmacy and to enable the links they've got with the big pharma in order to be able to sell more drugs, rather than look at problems. They're dealing with symptoms. And I think if you can prescribe exercise, which is fundamentally what I think the sexologist was talking about, and all the upsides to it, that's what it's about. It's about good, healthy, vigorous exercise. And I think a GP should really be saying, have you thought about taking some exercise? And then it's less awkward for the patient. But in general, yeah, a bit of vigorous exercise is something that can heal a lot of problems, especially maybe with some fresh air.
But isn't it your own business? And also, if you're worried about litter in the street, you've got to be very careful what you do in the fresh air.
Listen, I think also
any al fresco hanky-panky is not a good idea. That really might frighten the horses and the feminators. I
think also our sexologist friend puts it right, because it's about addressing it in an appropriate way. And it's not saying, you've got a dodgy ankle. Have you thought about doing some shagging? I think
sure,
it's
we're
about.
not allowed to say that on television this time of day. I apologise for my vulgar guess.
The number of times you've said the word
Let's take a
sex,
pause so you don't have to say
worse.
anything else. Let's go to Grace. Grace is in London. Grace, what would you think if your GP just introduced the notion of sex and whether you're having enough of it?
I might laugh, or I might feel violated and make a complaint to the relevant body. I think it's completely nuts. I'm a disaster. My life is a mess in many ways, but not ever having sex is not one of the problems. There are other things, and I think our society has been lied to into thinking that we all need to be having sex all the time, because sex sells. Emma Thompson is not a medical expert, but she makes money from being in films where sex is on screen. And so we've been kind of influenced into thinking that we all really need to be having sex all the time. But it's not ultimately necessarily what's going to make human beings happy in the long term. I mean, oxytocin was mentioned. And oxytocin release during sex does mean that people become emotionally bonded to some extent, depending on the individual, with the person that they're with. And so actually to just go from one partner to another in the way that our media has tried to influence us to do doesn't necessarily lead to long-term happiness. It can mean that people can be hurt long-term, but they've been led to think that they ought to just be getting on with it. And I don't think that's what we're designed for.
Couldn't agree with you more. Also, I really agree with Grace that there is a kind of cultural pressure just that everyone should be having sex, everyone should be having lots of it. And if you're not, there's something peculiar and strange about you. And also almost that it doesn't really matter who you're having it with as long as you're having it, which I agree with Grace can be very damaging. The other thing that nobody ever seems to say is lots of people usually in long-term relationships, but also in short-term relationships, have a terrible sex life where very often the woman isn't enjoying it at all and very often has got quite good at pretending to enjoy it, but actually only to be polite, but is really suffering it and can't wait. And that old phrase, pull down my nightie when you're finished, it's very often like that. So it's not as if everybody who's having sex is having fabulous, fireworks, sparkler, wonderful sex. It can be an absolute chore and a total fag, particularly for women, in my view.
What Dr. Ben said, though, that I did want to call up on is it's very different having it in a safe space with somebody you feel safe with. And even the word pleasure for me is a really difficult word because I just feel like I need to close my ears and shut my eyes. But I do think there is something about knowing your partner, loving your partner and having a loving sex life rather than, that's just part of it. And I adore my husband and obviously whatever else, I can't even bear to go into this conversation. Yeah. But I think it's not for the GP to bring up on any level.
William?
I think a clever, subtle GP who feels that there's an opening for a discussion that might help the patient, I don't think that's a terrible thing. It's all about, good sensitivity from health professionals who know what they're doing and can read the room. And I think it's quite obvious if someone does not want this subject brought up. And then I think I think our sexologist friend probably, given the fact that he is a sexologist, when you go to see him, it's probably you want a bit of sexology. So